work at identifying a space that we could all meet at for our meeting on March 30th, when we'll be talking with the HRSA reps. I think we might just start going around and doing introductions and updates, starting with, how about Kelli?
Good afternoon, everyone. Kelli Parcher, Executive Director of AL 360. Things are going great with our organization. Pfeiffer House is full as always, unfortunately, and has a long waiting list, and are connected to a lot of community partners. And then our community resource space for youth and young adults is doing well and gaining traction.
Good. It's a happening.
It's a happening place. I appreciate it. I've seen a lot of great faces on this screen in our area supporting our process and our young people in our community. I appreciate it.
Thanks, and thanks for all the work you did to pull that together. That's amazing that it's come together in this time frame. Lori.
Lori Tinker, I'm the chair of the EMS Council.
Good to have you here. Commissioner Brotherton.
Hi, Greg Brotherton, Jefferson County Commissioner. I guess I'll talk a little bit about opioid abatement settlements a little bit later in the meeting. So I'll just stop there and say hi.
Thank you. Cherish.
Good afternoon, everyone. Cherish Kron, Executive Director of Olympic Community Action Programs, your community action agency for Jefferson and Clallam counties. Letting you know that we are on track for Seventh Haven to be completed. That's a 43-unit affordable housing for individuals less than 50% of the area median income. We're going to be having a ribbon cutting ceremony at the end of the month. Some of you might have already gotten that invitation. If not, I will in the chat drop a link to an RSVP if you'd like to make sure that you get information about the day and time of that event. But Friday the 31st in the afternoon is what it's looking like. And we're also going to hopefully earlier that week, depending how the punch lists go this weekend next, have our partners out for a private tour so that you guys can, see some of the spaces and ask some questions about, the facility before, a big groundbreaking thing. And the childcare piece of that comes separately. So that, will get done and started as we're getting, residents in actually. So 43 units, we got well over 150 applications. The Housing Authority doing their due diligence. As you know, when it comes to the federal government, there's a lot of paperwork. It's not as simple as, oh, it's just a donor thing and, somebody's worthy, right? I mean, it literally can sometimes be their $15 over income. I mean, it's very frustrating, a sad situation, but, these are the bureaucratic hurdles that we often deal with at the agency. We continue, to have people sort of coming and going from Caswell Brown. We continue to encourage folks, especially those that are encamped out in the areas, to come to site, be willing to accept the rules of the community that the community has put together, and be there for the various services, and thank our partners that continue to come onto the site and provide those one-on-one services for folks with mental health and substance abuse issues is greatly appreciated. In that upper site, we are put in another application yesterday for replacing the emergency shelter and creating some permanent supportive housing for some of those folks that have lived for years, if not decades, at some of the emergency shelters in the county. So we've only got $1 million. It's going to cost at least probably $5.5 million. So might have half of it then funded through this grant that just went in. And then I'm looking for some other dollars for emergency sheltering. Sadly, the rent has gone up at the American Legion. We've usually only paid $60 a month. That went up to $1,000 a month last year and now has risen to $1,750 a month starting this next year. So we've got to make some decisions about how we're going to afford that and what's going to happen there, but continue to thank our partners with Coast who help supply food, to our folks there and at Caswell Brown. Housing office is open, available for appointments at our 2120 West Sims Avenue. You can always go there. There's a Ring doorbell. And then on Fridays, there's walk-ins. We're continuing to expand that office a little bit. So working on that, and we'll keep everyone posted there. And yeah, as always, if you need anything, feel free to reach out to me, and just grateful for all the connections and support here. And, you know, working with especially our housing team, you know, in helping out some of these folks. So thanks.
Thanks, Cherish. Jim.
I'm Jim Novelli, CEO at Discovery Behavioral Healthcare, and don't have anything to report as of this moment.
Good. Matt.
Matt Reddy, one of the Jefferson Healthcare Hospital Commissioners. I don't have anything to report, but happy to see everyone.
Good to have you here. Anya.
Hi, everyone. I'm happy to be reporting from Jefferson County Public Health. Monday was my first day as the harm reduction coordinator. I'm still going to be continuing all of the projects that I've committed to do with you all. We showed love in the time of fentanyl at the Nest a couple weekends ago. We had around 30 people attend, some of you in this room. Thanks, Lori and Gabby and the Nest and Kelly and folks for being there and showing up. I distributed 20 naloxone kits at that screening. I've rescheduled. We ended up canceling the quilting screening because of snow. Thank you, Chief McKern, for your insight on the weather down there. And I just rescheduled that for Monday, April 17th at the Quilting Community Center. So I've reached out to a couple of you, but if there are other folks who want to be on a small panel after the film to talk about the topic, then please reach out to me. And then otherwise, I think this might be in the slideshow as well, but we have the Blake Decision Town Hall coming up on the 27th in Quilcene as well. Those are my updates.
Great. Thank you, Anya. Barb.
Good afternoon, Barb Jones with Jefferson County Public Health. I am the CHIP manager, and I don't have any updates for the group. Thanks.
Well, thank you for being here. Chief Olson.
Tom Olson, Port Townsend Police Chief, and really no new updates at this time.
Good. Dr. Carlbaum.
David Carlbaum, Medical Program Director for Jefferson County. Not a lot of updates. Excited to attend Love in the Time of Fentanyl. I had a peek at it, and it's a very moving documentary. So if you haven't seen it, I would encourage you to go. And also our fire EMS partners have done a great job of passing out naloxone that we're reordering another 75 to re-up our stash. There have been multiple calls recently in the past month where citizens have administered naloxone and the patient is not needed rescue by EMS.
That's great. It's doing what we want to do. Chief McKern.
Well, I'll echo. First off, I work for Dr. Carlbaum and Lori, so I'm just there right behind those folks. I echo. It's been extremely busy. Yeah, thanks, Anya. You keep passing out those naloxone kits, and that's going to save us a lot and save us on calls. So keep doing what you're doing. But no, I'm Quilcene Fire Rescue down on the south end, and we're busy. And we're looking forward to the 17th and having our little panel and some other items that are going on.
All right. Patrick.
Yes, thank you, and good to see all of you. NAMI, Jefferson County. We continue with our support groups and classes. We are also very excited because we received funding from the Accessibility Community Committee, which is staffed by the Health Department, for a stigma reduction project for mental illness that will be launched in August. So we're busy working on that. And again, we're very excited. I know that many of you here follow the legislature very closely. And there are about 100 items that affect behavioral health, including the budget. We're especially, there's some work being done on the assisted outpatient treatment program, the 988 program, continuity of coverage, the behavioral health workforce, and of course the True Blood decision. And then Jim can probably speak to this better than I can, but there's also a request in for an increase in Medicaid reimbursement. Let's hope that all of that is happening. And family, and finally, all of you follow this, most of you follow this closely. I think it's reasonable to be optimistic about funding for the Jamestown led mental health crisis 16-bed crisis unit, and let's see what happens with that. We know that Representative Theringer is the chair of the House Capital Facilities Committee, and that helps. So anyway, there you have it.
Good to have you here. We also do have a couple of slides toward the end of the packet that has links to the various legislative things. Maybe not all of them. If you see some that are missing that we should be there, please let me know. Gabby.
Gabby with Believe in Recovery. We have a lot of exciting things happening and a lot of exciting things coming in the future. Nothing that I am ready to announce right this second, but soon.
All right, thank you. Rebecca?
Hi, everyone. I am Rebecca Marriott, the Therapeutic Court Coordinator for Jefferson County, and I do not have updates at the moment.
Well, our update is that you are here, and that we're very happy to have you there at Therapeutic Courts. Yeah. Denise.
Thank you. I'm Denise Baker. I'm the Jefferson County Public Health Community Health Division Director, and I'm here to say welcome to Anya, and also Anya mentioned the Love in the Time of Fentanyl and the Blake decision town hall that's upcoming, and Lindsay Scalp is here from the Empowered Teens Coalition, Port Townsend, representing all three of our coalitions in all three of the school districts. And soon the coalitions will be hosting the drug take back April 22nd in all three of our main school district communities. Medication.
Excellent. And I see Lindsay put the link for that flyer for the take back event in the chat. Adam.
Hi, Adam York from Jefferson Healthcare. I work in the data analytics department. I've been trying to think what I can and shouldn't say, but yeah, it's gonna be an interesting year for data for the hospital and the area that, you know, Epic or EHR. We're anticipating an upgrade this April that affects how we record things like sex and gender and even pronouns officially. I think it's all directed by the state. I'm not going to pretend to know all the details, but it's going to impact. It seems like it's kind of a pretty big impact. This will be kind of required to collect more data around this, especially like sexual orientation and gender identity. So, and whatever else I don't know about yet. We're still learning. So, but yeah, an interesting year, and then we're still in the very early stages, but still moving forward a data warehousing initiative. So yeah, a lot going on.
It sounds like there is. Thank you for being here, Adam.
Yeah.
Colleen.
Sorry. Hi, Colleen Rodriguez. I'm work at Jefferson Healthcare in the medical group, and I'm part of the behavioral health team. And I also am the EMS training coordinator, and I really don't have any update or anything to report. Thanks for allowing me to be part of here.
Well, we're happy to have you. Cassidy.
Hi, everyone. Cassidy Chang. I'm the population health coordinator over at Jefferson Healthcare. I also don't have anything new to update, but I'm happy to be here and hear everyone else's exciting updates.
Good to have you here. Lindsay.
Thanks, Lori. And hi, everyone. I'm Lindsay with Jefferson County Public Health. I coordinate the Community Prevention and Wellness Initiative and do general adolescent substance use prevention work in the Port Townsend School District primarily. And yeah, as Denise mentioned, we've got the plan going for medication take back event on April 22nd, and huge gratitude to the local law enforcement for partnering with us on this program. It's really amazing and a transformational type of event that we can hold. Another thing we've got going on right now is the Guiding Good Choices Parenting Workshop. And thank you so much to Brian with Dove House and for Recovery Cafe for hosting us for that. We're working with 3 parents, and that is a small group, but we really appreciate any parent who's open to being a part of the process. The Guiding Good Choices program is 5 sessions, and it's really valuable content, and I personally enjoy it a lot. And also thank you to my co-facilitator, Alicia, who is doing this program with me this spring. And that's it on my end. Great to see you all.
Well, there's a good bit going on there. Thanks for being here, Lindsay. And Jake.
Oh, hello, Jake Davidson, Jefferson Healthcare.
Hi there. Any updates from your side of the?
Oh, we got lots of things going on, but no, nothing to share.
All right, thank you. So we were going to have Apple talking about Jefferson County Public Health and what comes next, and it looks like maybe Denise is going to step in. Thank you.
Yep. Yes, so Apple was asked to write a message about where Jefferson County Public Health stands regarding the Behavioral Health Consortium and the end of the HRSA RCORE 3-year grant funding. And so she prepared that message, and I'm going to read it because she is not able to attend today. So thank you for bearing with me. I appreciate everyone's patience and community. Yeah. So as a consortium, we are facing a natural and expected evolutionary step in our work, the work of being part of solutions that nurture Jefferson County's behavioral health system. What comes next? This is the question we will collectively address. The 3-year HRSA RCORE grant has enabled this consortium, along with each member's participation and contributions. In this final year, year 3, the grant ends and the BHC graduates to the post-grant phase of its lifespan. This shift must be toward a model of sustainability and independence from Jefferson County Public Health's role as sponsoring entity. The end of this grant gives the opportunity to launch the next phase of even better things to come. And Jefferson County Public Health hopes to remain a participating member as that evolution proceeds. Like so many of you and your organizations, our health department's behavioral health services have grown because of its seat at this table. Our ability to conceptualize what is possible has developed. We have taken risks. We've confronted deficiencies in our service provision. We've navigated new meaningful partnerships. We've bolstered communications that are more equitable and inclusive. We've developed stigma reduction strategies. We've become nimbler and more innovative. And we've secured a full-time harm reduction coordinator who will work hand in hand with our 3 prevention coordinators to cement this work in sustainable ways. We're building a robust program where there was not one before. There are so many successes to celebrate that have been made possible by the BHC, and we thank Lori for her fine orchestration, including the writing of the proposal, gathering and reporting data, tracking services, and facilitating these meetings. As a consortium, we have participated in generative shared visioning. We build new competencies, we've refined data collection methodologies, and helped prop up meaningful new programs throughout our community. The consortium and its original growth out of public health's CHIP process has been exemplary. So thank you.
Thank you, Denise. I appreciate you bringing that message. I want to underscore how grateful this community can be that public health anchored the startup of this whole effort with the consortium. They have performed as finance administrator, which is no small task on a grant of this size. And so their their power in the origination of everything that the BHC is today and whatever it might go on to was fundamental to bringing all of us together at this table and being productive and serving our community in the way that we have. Are there any questions, comments, spirits of gratitude that would like to come forward at this time? Denise, I really do appreciate you bringing the message. I'm sorry Apple couldn't be here. Okay, I'm going to move on from that and ask Greg Brotherton, because I see that Jolene isn't here, if you might talk to us a bit about the opioid settlement funding flow, what that might look like. In your packets, I'm not showing the slide right now, but in your packet, there's an overview, and hopefully it's as accurate as what Greg is about to tell us. Go ahead, Greg.
Great. Well, yeah. I'll talk kind of high level and then kind of what decision points are in front of us. But so basically, you know, the first opioid settlement that came out through the state was split 50-50 between the state and local impacted communities. Both cities and counties got the other half. We needed to sign up an MOU or interlocal agreement, excuse me, between Kitsap, Clallam, and Jefferson County for our Behavioral Health Administrative Service Organization, which Jolene is the clinical director of, to administer those funds. And we did that. After that happened, a little bit more, the rulemaking is still not done or wasn't done at that point. And it became pretty clear that if they wanted to, then the BHASO could directly pass through those dollars to the counties directly. They weren't all supposed to go into one pot in our 3-county instance, for example, though they could, and then go to a crisis stabilization center, just talk about one dream. They could, but our funding from that first settlement amounts to about a little less than $900,000 dispersed. We got the first 2 payments already to the BHASO of about 35 each. And then there'll be 16 more years of one payment a year. So that one is about $35,000 a year. We had a presentation that you can watch from our Monday Board of County Commissioners meeting at 1:30, where we talked through some of the permutations. And I made the I guess, initial recommendation that perhaps those funds could be used as a long-term funding mechanism for either continuation of the BHC or to be added into our kind of continuum of behavioral health RFPs, which would logically be the Behavioral Health Advisory Council. Jolene supported both of those ideas, as did Stephanie Lewis, the director. Our deputy civil prosecuting attorney was concerned that there might be a problem with the ILA if we allocate it directly and there isn't the 10% administration fee that goes to Salish BHASO, but the administrator is confident that that would be fine as long as the executive board of the BHASO approves of that use, which as one of those 3 board members, I am confident they will. Then there are more opioid settlements coming down, and we haven't made a final decision on that, and it'll be in front of the Salish BHASO in April, I believe, to talk about. If I can share my screen briefly, there are a couple more settlements that are coming through, and just this week, I received what those amounts and disbursements are like. Can you see that opioid settlements for Jefferson County up there?
Yes.
Great, maybe should I zoom? I'll zoom in a little bit. So I'll just give you a moment to process, but you can see that there's different payout calendars for whether it's Walmart or CVS or Walgreens. But again, if you look at the bottom left, it totals about the same amount. So this will really double that settlement that we're already looking at, and it will be the same rulemaking. In fact, we have on our agenda for this coming Monday, the 13th at the BOCC, I can even tell you the time. We are going to be signing or working on the MOU at 3 p.m. We will be taking public comment and potential action on basically signing the same ILA with the Salish BHASO for this settlement that we did for the previous one. I think there's one more settlement kind of coming down the pike at least, but I don't have any details at all about that. So what we know right now is approximately, somewhere between $1.7 million and $1.8 million over the next 17 years, a drip that comes in for very flexible uses. That document, if you want to see what those uses are, was also on our agenda at the Monday Board of County Commissioners meeting. And there was one cool thing in there, an ER MAT navigator, which I'm not sure we have, but I mean, it could be used for all sorts of things, these funds. So right now where we are is talking about a direct payment to the county with no administration by Salish BHASO, and then working out something between putting it into our existing RFP process or perhaps funding this body. I'm happy to take any questions.
That's a lot in there. Questions? Was that thorough, huh? Okay, you'll note in the package on.
Lori, this is David Carbone. Greg, thank you so much for advocating for thoughtful use of the funding. I guess I was a little unclear. You said you were going to mention some upcoming decision points, like who's going to decide if that money goes to BHC, fund continuation of a version of the BHC, or it goes into the giant pot at the BHAC, giant in quotes, of course.
Well, basically the Salish is going around to each of the jurisdictions and talking about what they want those uses to be. And it seems pretty clear, at least Clallam and Jefferson, the pots are small enough that it doesn't make a lot of sense. And Salish's recommendation is that the counties manage it themselves because, I mean, Kitsap's is 10 times ours, so their same distribution chart is almost $9 million. So it's a kind of a different decision point. But there's Salish decides whether or not I can go directly through, but that is the recommendation of the executive director and clinical director currently. So I don't think that there's a lot of chance that won't happen. And then ultimately we'll continue to talk to public health and stakeholders here. And, Jolene referenced the 87% of the BHC members that wanted to continue this, and of course, sort of the unique gathering that we are in right now as a really strong group. And that I think pretty much convinced my peers, but it would be up to the Board of County Commissioners after we get final approval from Salish as to how to directly appropriate those funds. And I think those are the two courses that we would see for these pots of money.
Can I ask sorry, you go ahead.
Will there be opportunity for public comment at a commissioners meeting, and how will we know when that happens?
Yes, I can bring it back to the next BHC meeting at our 3 p.m. this coming Monday. There is public comment at that, so we would certainly like to hear from stakeholders on this meeting, or customers and clients as well. So the first one, and all of our meetings are hybrid, so you can show up in person, but it's very easy to sign into the Zoom meeting and make a public comment there too. We also accept written public comments at any time to jeffbocc@co.jefferson.wa.us. And when I'm done talking, I'll throw that in the chat too. I think Anya and then Jim had a question or comment.
I had the same question as Dr. Carbone.
Jim.
I just have a comment. I just listened to that commissioners meeting this morning. It's what I do at 6 in the morning when I'm bored. I will say that Jolene, and as a tribute to really this group, this BHC, mentioned how this was really very unique, this group, as across the state and through any of the regions that don't have a group like the BHC that has done what it does, and the group that comes together like this. They're very, supportive of the BHC. And I think, moving forward, this is something that none of us want to see disappear. And I think, as you stated, 87% of the people on this committee, this group, want to see it survive. So I think this is something that we should really strive for and look at that funding source moving forward and how we make this continue to happen. Because there's lots of good things that are coming out of this. So just a comment.
Thanks, Jim.
Okay.
Anyone else? All right, let's move on to talk a little bit about our funding and what's been budgeted. I'm going to share my screen here quickly. The last time we were all together, let me confirm, you guys can see the screen, correct?
It says you've started screen sharing, but it's still black.
Let me,
There we go.
There you go.
Looks good.
yeah, there was a freeze up there. I thought, oh no, I've lost them all again. Okay, so the last time we were together, we all considered the Recovery Cafe, and I sent out a survey poll and that passed. And so this is the updated amounts that are going to the various, or that are budgeted for the various programs that we have. This is in your packet as well. I hope everybody was able to link into the packet from their Evite that I sent an update to today. So our Recovery Cafe approval went through, and then there are two other updates. One of them has to do, and I'll let Kelli give a bit of an overview, and then I'll tell you a little bit about the process that's going on. Once Kelli has told you a little bit about what we're thinking about for a $25,000 amount. Kelli?
Yeah, thank you, Lori. For those folks that haven't had an opportunity to read the packet, I mean, I think it's fairly self-explanatory. We're looking to access some funds to purchase a vehicle for transportation. As we all know, right, we're in a large geographical area, and getting access to services in our community is very challenging, especially for the population of folks that we serve through ALF 360, and that is youth and young adults. Typically, the majority of that population isn't even a licensed driver, but still needing to access services. And so we want to be able to have the ability to not only provide transportation to that young population to access to behavioral health services, but as well as getting them to prevention and intervention kind of programming. And the vital piece is really, we can have the heart of Port Townsend, we have a transit that does some sort of transportation, but then we have all of our South County folks that have quite a bit of challenges. And so that vehicle will not only help get young people to our programming, it will also help our outreach and ally staff go and meet that population of people where they're at in the community, so we can kind of get them connected to either our services or other behavioral health services within our community.
So I'll tell you a little bit about the process for this. Once you do something that they're calling a capital expenditure, so anything over 5,000 that's equipment, we need to go to HRSA and get a secondary approval. And so we've gathered the quote that you see in the package. In fact, at the end of your meeting packet is the whole package that we're going to be submitting to HRSA, where we've Kelli got quotes for both the vehicle and the insurance that it will take, and sort of the reasoning behind why we're doing this. And hopefully they will come back with a positive, and we'll be able to act on this before that quote is no longer valid. What I will say is I would like to make sure that both this group is aware of it, because if it is passed by HRSA, I will quite quickly send out a voting survey to get your vote on it, so that Kelli can move quickly rather than waiting until the next meeting. So all of the information is here. Is there any other information folks here would need or would like to discuss before I submit this to HRSA? Okay, I'm taking that as a no. Lori, were you thinking something? Lori?
No, actually, you answered the question while I was typing, so it's like, you're just so smart. There we go.
Well, that was probably all Kelli. She did all the legwork on this. And then the second thing that I wanted to talk to you folks about. Oh, sorry, Denise.
It looks like Puget Sound. Puget Sound. There's a person signed in called Puget Sound something. I'm sorry. There's someone who has a question in the chat.
No, that was me. I'm sorry.
Oh, you're Puget Sound Fleet.
Yeah.
Oh, okay, sorry about that.
I'm the admiral of the whole fleet.
Sorry
but thanks for noting it.
Yeah, sorry for the interruption.
And thank you, Denise, because sometimes I don't have all of the things and I wasn't seeing the chat at that moment. So thank you for that. Moving on, the second thing that's going to be in that packet that we're submitting to HRSA is the naloxone vending machine that we've been working on for a long time to get installed into the Brennan Community Center. We're getting a quote on that, so we don't quite have it, but we know that it's going to be between the machine itself, the installation, insurance. There's some software technology that needs to come along with it, and possibly a maintenance contract. We're thinking all of that will add up to about a $25,000 expenditure. And I wanted to let you folks know this isn't something that we're voting on. It's something that we've already put through as going to happen. I just want you to know that we're on the verge of submitting that into HRSA, and we'll hopefully get a positive answer back at the same time we do for the vehicle, and we'll be able to move those things forward. And what that does do at that stage is we will have allocated out most all of the funding that we have for this grant through the end of August 2023. There's probably going to be some slush, some places where we won't have spent as much as we thought we were going to. But overall, I don't think that we're going to have any big amounts of money that we're leaving on the table. And certainly as we figure out if there are some of our partners who are underspent and don't think that they can spend it until the end of August, we will come back to you as quick as possible to let you know what funds are available so that we can brainstorm amongst us as to what the best use of those funds could be. Any questions on any of that? Okay. I'm going to just fire forward then onto our, many of you received an email from me yesterday with some workbook sheets that will be filling with or populating with data from each of our members or each of our relevant members, and then we'll be adding them together into one big workbook that both goes to HRSA. They call their workbook the PIMS workbook. And then we've also got data that we've been collecting as a consortium table for more years than we've had the grant. And so both of those sets of data we are trying to collect by March 24th so that we can get it collated, meet the deadline for HRSA, and then not in April because we're canceling the April meeting, but in May, Lisa Grundle from HFPD will be with us, and we'll look at all of the data that we've turned in together and see if there's any trends that we can see, analysis and insights that she has been helping us sort of craft from the data that we've been collecting across all of our organizations. Are there any questions about the data, the fact that it's when it's due? You all know that you are welcome to reach out to me. I'm happy to sit with any one of you or groups of you as works best to collect that data. Looks like no feedback there. Okay, I will be reaching out individually to several folks around the request for information, which is very specific information, sometimes specific to the hospital or sometimes specific to public health. So I may be reaching out to you on that topic as well. Moving along then. Anya, do you want to give us a little bit of an overview of the event that is coming up with the town hall? I'm sorry, it's not Anya, it's Lindsay maybe, or maybe it's Lindsay and Anya.
I think either one of us. Lindsay, are you here?
Yeah, and I can talk about it. My cohort, Holly Gum, is actually the coordinator for that event. But I can certainly speak about it. I don't have a flyer for it at this time, but
it's in the packet.
Oh, fabulous. Great. Sorry, I didn't see that. But let me think. Anya, could you summarize sort of the panel of participants?
I can. Let me pull up the email so that I can actually summarize it well. Sorry for not having this ready. There we go. So let's see. So this is a community conversation to talk about navigating possession of banned drugs and substance use and how the Blake decision impacts our community. As we know, right now the legislature is also looking at legislation that would the impact of Lake decision. So this is kind of like a before the end of the session update on what the state of things are right now. I'm trying to see who's on the panel. I believe Nat Jacobs. Is that someone from the Public Defender's Office?
Yeah.
Yes.
Yes.
And Amber Lorenzo from Believe in Recovery. And Brett England.
And Brett is from the Sheriff's Department.
Thank you. So that's who's going to be on the panel. And I believe the goal is just to have a community conversation to clear up any misunderstandings about how the Blake decision impacts folks in our community. And yeah, I think that's it. Lindsay, more to add?
Yeah, just some sort of housekeeping details. I believe there is a cap on how many folks are going to be able to attend in person just based on the size of the space. And so there is going to be an option to RSVP to attend virtually. And I'll try to find both of those links in the next couple of minutes and post them in the chat. But Holly is hoping that everyone who does attend can RSVP, either for attending in person or for attending virtually. And I believe, is there going to be some type of naloxone training associated with it, Anya? That's great. I see a nod. And I believe there's going to be food available. And that is all I can say at this time. But yeah, looking forward to how this turns out. I think it's, it sort of came out of conversations that Holly and I, and of course, many of us and all of us have been having about even though we're in different places on the continuum of care. For example, we spend most of our time in the prevention little triangle. We are so needing to be resourced across the continuum of care and understand what's going on in terms of recovery, intervention, and what's happening with the laws around possession. So we're hoping to just bring everyone together and have a good conversation, and really appreciate everyone who's on that panel and helping coordinate it.
Great. Thank you, guys. This should be a very interesting conversation. Lisa Ray Thomas had put in the package an announcement about the Transforming Our Communities event that's going to be happening in June. And I'm just highlighting that to you folks. Their dates are going to be June 27th and 28th. They're going to have a hybrid of in-person, or the Zoom part will be in the morning and the in-person will be in the afternoon, and they're doing this in different regions around the state. So it should be an interesting set of conversations that you'll be able to meet people, I think, from across a range of sectors that we don't always have in one place. And so I'm really looking forward to what that event will bring forth in terms of connection and education. Our next meeting is going to be with the HRSA reps, and not everybody is going to be at that meeting because we've sent out specific invites based on those who are either on the memorandum of understanding or who are very interested in being on something in the future, or who maybe feel like it shouldn't happen altogether. So we have and welcome Sheriff Noel, nice to have you here. We are going to be having a conversation with them about sort of looking at the lens of sustainability and what do we want the mission? Do we want it? What should that mission be? What might it look like? Where could it be anchored? Now that we're clear that as this grant ends, it will move out of public health's domain, and wherever it lands, it will land. So that's the conversation that's going to be happening at that meeting on the 31st from 2 to 3:30. We're still working on exactly where it's going to be held. I got a few great ideas of places to search. We're hoping at the beginning of this meeting, we're hoping to be able to do a hybrid option. But ideally, we would have as many people there in person as we can, since we've got people who have actually come out here from DC to meet with us. And then in the day prior to that, so the HRSA reps are going to be here Wednesday, the 29th, the 30th, and the 31st. And so on the 29th, we have a combination of things set up. There'll be a meeting. First, we'll take them to drug court in the morning. There'll be a meeting with law enforcement in the late morning, early afternoon. Then we'll be going to DBH and then down to South County to speak with the fire chiefs there. And I have a couple of people that I want to reach out to outside of that. Gabby, if there is time and place, I'd like to get them over to Believe in Recovery to hear from you. And mostly we're working on getting them around to all of the different players, or at least as many of the players as we can fit in before we come into that meeting. And so our time slots are really tight right now. So if I've reached out to you and I've sort of said, and this is the time, if you can't be there, know that there's nothing personal about it. We're just trying to fit in as much as we can. And I know I need to still reach out to Chief Black and figure out what time slot could work. At the end of the day, we just want everybody to have walked into the room where we're talking in the collective conversation, making sure that everybody's been heard before we come into that room together. Is there anybody who wishes to have, a close conversation with those reps before that meeting that I have not yet talked to, in addition to Gabby and Chief Black? Okay. All right, then I'm going to consider those two, the last two that I'm going to try to fit in, and we'll go from there. Are there any other questions? I think we're going to get out early today, and I think that's a good thing.
Lori, I was going to mention just another event, if that's okay, to give people a heads up.
Please do.
Yeah, so for those of you not aware, I'm the president of the Jefferson Pro Bono Lawyers. And our next clinic is on Saturday, March 25th. And we ask people to please pre-register before March 16th. That gives us the opportunity to sort of match folks with an attorney that sort of specializes in that area. And it's really great to have, support folks like you all helping these people keep their appointments and, pre-register, goes a long way so that they can speak with an attorney and get some advice about, their direct issues, or if they've got some, stuff in their past, they'd like to, get some of those things off their record. This is a great opportunity. And I'll put the link and phone number in the chat, but you can reach out to the Jefferson, Jefferson Pro Bonos. Of course, you can always call the clear line too, and that gets you to some of the Pro Bonos too. But that's the next clinic. So I just wanted to share that. So important to try and help these folks get their records clear, so that, if they're ready, move on with their life. That's one of the greatest things to do. So
absolutely. Thank you, Cherish. Okay, you'll note in your package, there's a couple of slides that cover the legislative bills that we're following. Feel free to check in there. And then there is a peer support group that meets. It's sponsored by our grant, but basically peer counselors from all over the country can phone into there, and they have meetings set up for support. So if you've got peer counselors that you think you'd like to hook up with, that information is in your meeting packet. Any other thoughts, questions, comments before I let you all go? Give you back a couple of minutes of your day.
All right. For the good of the order, I forgot to mention one of the behavioral health related things I did last month is you took me to coffee at Nest, and I challenged them to make me just a single shot of espresso, which is kind of a complex thing. They did great. It's now my favorite coffee place in Port Townsend.
It's a great place to be. All right, then. Thank you all. And we'll see some of you on the 30th, if not before. Have a great afternoon. Bye-bye.